Jamaica has introduced an initiative as part of the organization's overall focus on providing greater access to quality healthcare. We have with us to speak on what's happening there Sandrine Davis, Country Director of International Samaritan Jamaica. Welcome to Smile Jamaica, Sandrina. Good to have you with us this morning.
Good morning, Simone. Thank you so much. Good morning, Jamaica. And good morning to my extended family in Riverton.
Of course. How are you doing this morning, lady?
I'm doing well. Thank you so much.
Because you're doing good work, and that often makes you feel better about yourself. Tell us a little bit about International Samaritan Jamaica. It's a charitable organization. Tell us about your mission, when you started, little background.
Certainly. So I want to just start by saying that the International Samaritan mission is something that is a global mission, right? So presently there are International Samaritan operations in Nicaragua, Honduras, Ethiopia, Guatemala, and more recently, Jamaica. The organization itself exists to, as it were, walk hand in hand with persons living in and around garbage dump communities. And the end goal is to assist persons to break out of poverty. Jamaica is just a little bit over a year old, and dare I say, we've not been working, but we've been serving. And that has been an amazing journey so far.
And it's particularly communities, you say, in and around garbage dumps.
Right.
In each region, in each country in which you operate, that's the situation.
That is the exact situation. When you say there's nothing new under the sun. So some of the present realities that would exist in Riverton are what is, happening in the other countries that have their garbage dump sites as well.
And how new are you to this kind of work, Sandrina? Is your background social work? What's your background?
Personally, I've been working in the nonprofit sector for the last 10 years.
Okay. And so when you heard of this initiative and you actually went into the community and saw the realities of that situation, would it have struck you as, oh my gosh, I can't believe people are living this way? Or is it something that you would have been used to based on your previous work?
I'm so happy that I get a chance to answer this question. My experience in the nonprofit sector prepares me for everything, so I'll start there. But also, I think there is just a great misconception of exactly how things are. And so having gone into the community and spending time building relationships with the community members, I'm able to see the big picture. So while there are challenges, there are all these other amazing things that I have learned over the last year and a half about the community. And I'm so happy for the opportunity to share that with Jamaica. We would know the word Riverton from the news, from the media, but many of us have not passed Spanish Town Road to go in and to meet the people, to see the children with bright faces and brighter futures if we continue to walk hand in hand with them. So yeah, if you want to visit, I will give you the tour.
We should. That would be great. Kafuti, you can note that. Okay, so tell me a little bit about this new initiative that you launched on the 14th of April, which has such fantastic implications for the folks who live in Riverton as it regards their healthcare.
Okay, so this Telemedicine Initiative is this other step as part of all the other things that we've been doing over the last year and a half. We really want to show Riverton that we're there for everybody. So while some of our other programs, are specific to numbers of people, this Telemedicine Initiative is for all of Riverton. If you're living in Riverton, you're living in Callaloo, you're living in Shanty, you have an opportunity to access this service free of cost. Pretty much what it is you'll be able to video chat, let's call it that, or video consult with a general practitioner based on your different challenges. Now, we all know that there are some challenges that telemedicine can't solve, right? But it's a great start, even in this time of the pandemic, when persons are afraid to go into crowded spaces. We know the health sector is already stressed, and we just want to play our part in ensuring that the Riverton residents have access to one, quality healthcare, not have to worry about if they're going to have to pay for it, but also in the comfort of their community where they may feel safer and not have to be too concerned about, will I be more exposed to the virus during this time? So that's really what it is.
The cost is covered by you folks, but there are other implications like devices and credit. And is it done from a central location, or do you have other partners or stakeholders involved?
So one of the things that persons actually can just call 802-8423. Remember to put 876 before that. You can call, you can WhatsApp. Once your appointment is made, you will actually come to one location at the time of your appointment where the tablet, the laptop, the webcam, everything and internet is already set up for you to have your private consultation with the doctor. We would have a nurse on spot to do the regular preliminaries so that the doctor can access those vital statistics for you as you enter into the conversation. And I'm glad you said that about the challenges of internet and so on. One of the things that we had to do during the rise of the pandemic and how it affected education was that we established 2 community Wi-Fi hotspots. I want to just thank Riverton Meadows Early Childhood Center and Riverton Meadows Baptist Church for giving us that access. So on a daily basis, Simone, children go to these locations and are able to go to school to access their classes, access their lessons. And our team, along with many volunteers from the community, show up and support the children during this time. And we also offer them lunch while they're there with us on those days.
Fantastic. We're all in this together. This project is the embodiment of that phrase. We are going to get through this, and only together can we do that. Great initiative. In addition to what you mentioned are some of the other things that you've done, Sandrine. Face masks in the community, food and personal care packages to community members, donation of tablets and laptops to scholarship recipients. You funded medicals for back to school. You spoke about the Wi-Fi hotspots for students to access the internet, and you've awarded 75 full scholarships to students.
Yeah.
Fantastic.
Yes.
And now this. So you're taking care of the community, mind, body, spirit, in a comprehensive way. And we thank you for the work that you are doing. What do you want to add before we go? Anything you want to say to the folks who are... Yes, go ahead.
I want to just thank our partners in Michigan, USA, because that's where we get the bulk of our funding from. They're the ones fundraising and echoing the cause of Jamaica so that we can have the money needed to do what we have done. But I also want to thank Jamaica, who has really just supported us, especially in 2021, with some social media appeals and so on, with some of the other things that we've done. We did a Loving Lockdown thing when the first 3 weekends of lockdown was announced. We asked persons to donate food items because we knew that extra families would be going home for the weekend locked away without food. And let me tell you, my social media family stepped up and they have consistently supported. And what we want for this year is more local support. We're all going to play her part in advancing the welfare of the whole
human race. That's right. Thank you very much for the part you are playing, Sandrine. I appreciate you stopping in this morning. Great initiative. Love to hear it, and all the best with it. And good morning to the folks in Riverton this morning who are watching Smile Jamaica. Sandrine Davis, Country Director for International Samaritan Jamaica, showing some good news with us this morning. Let's continue to rally around that initiative to better our fellow man. Up next, pros and cons of operating a gig economy in Jamaica. But first, here is a 2018 band rewind performance from Ras Zachariah.
Life and no bed of roses. So me have to pray for the youth and no food. Dear back without closing. Life and no bed of roses. So me have to pray for the youth and no food. Dear back without closing. In the ghetto where we grew up, years of variation is all we know. Everywhere me go, me see the poverty a show. Everyone a hustle, we try make the dough. Oh, we make it true, sometime only Jah know. Pray for the youth, them when you sleep out the door. No, don't know them never been there before. So what time feed them, free up the door. without closing. Life and no bed of roses. So me have to pray for the youth and I no food. Near back without closing. Yes, Missy said them no care for the youth. And Missy said them not share with the youth. What kind of future them prepare for the youth? No knowledge of yourself, you're like a tree without a root. I say education is the absolute. You them a mind, I beg you join a pollute. Don't put no gun in a them and figure shoot. Or give them no forbidden fruit. Life and no bed of roses. So me have to pray for the youth and I no food. Near back without closing. Life and no bed of roses.